unable to join with us as there is a limitation in participation number, we are streaming live through our YouTube channel and the link is being shared in the chat box. Kindly circulate among your friends and students to view the session. Thank you all. Prayer is an expression of total faith in the present power within and around us. Before we commence this solemn occasion, let's invoke the presence of Lord Almighty for His grace and blessings upon us. I request now Mr. Anjaneya Prasad, first year basic BSc nursing student, for the prayer song. Thank you, Anjaneya Prasad. The joyful heart sees and reads the world with a sense of freedom and graciousness. We invite our greeters to spray the sweet aroma of happiness through the words of welcome. I now call upon Mrs. Shashikala, Assistant Professor, Community Health Nursing Department, to welcome the beautiful gathering. Over to you, ma'am.
Thank you, ma'am, and a pleasant, very good morning to one and all who have gathered us in this beautiful program. It is a glorious moment to extend my warm wishes on behalf of RV College of Nursing. I, Mrs. Shashikala, Assistant Professor, take this privilege in welcoming each and everyone to this program. At the outset, I am extremely delighted to welcome Professor Dr. Y.S.R. Murthy Sir, Vice Chancellor, RV University. Dr. Murthy Sir possesses a rich and a diverse experience of over 35 years across academia, government, media, autonomous statutory bodies, and non-governmental organizations, both at national and international level. Sir has held many important and sensitive assignments, including Director Research in National Human Rights Commission and Director Media and Communications in Prime Minister's Office, President's Secretariat and Cabinet Secretariat. Sir had the privilege of working closely with the Chief Justice of India and several court judges. Sir joined as a founder faculty member of Jindal Global Law School and has held Jindal Global University for nearly a decade as a registrar during his rapid expansion phase as a part of its top leadership team. We are happy to have such an eminent and a dynamic leader amongst us as the chief guest. On behalf of RV College of Nursing, we welcome you wholeheartedly, sir. Next, I would like to acknowledge my hearty welcome to Mr. Raghavendra Kamru, sir, Advanced Clinical Practitioner, Accidents and Emergency Department, Newham University, Hospital, London, UK, and President Vishwa Kannada Nursing Officer Welfare Association for today's event. On behalf, Sir had worked as a general nurse in Nimans, Victoria, Vignan, and elderly psychiatry. Sir has completed his neurological nursing specialization care course under WHO and advanced practitioner course. Sir has over 13 years of experience as a staff nurse in UK and has worked as a false champion, infection control nurse, advanced nurse practitioner in frailty team for an year. On behalf of our College of Nursing, we welcome you, sir, wholeheartedly. Next, I extend my cordial welcome to Dr. Gajendra Singh SR, Principal, RV College of Nursing, for his enthusiastic support, encouragement, and guidance in organizing this webinar. On behalf of RV College of Nursing, we welcome you, sir, ardently. Next, I bid a warm welcome to all the eminent and renowned speaker of the day, Ms. Manjushri Hegde, Clinical Nurse Manager, Northwick Park Hospital. On behalf of RV College of Nursing, we welcome you, ma'am. Next, I would like to welcome Dr. Muni Kumar Ramaswamy, sir, Consultant, Nurse, Palliative and End of Life Care, NHS Hospital, London, UK. On behalf of RV College of Nursing, we welcome you, sir. Next, I would like to extend my warm welcome to Dr. I. Clement, sir, Chief Editor, Rajiv Gandhi University of Health Science and HOD Research and Development Department, RV College of Nursing, for taking efforts in planning and guiding us throughout in organizing this event. We welcome you, sir. Next, I would extend my amiable welcome to all the HODs of various departments, faculties, staff of various institutions, and delegate who have joined us in this webinar. I wholeheartedly welcome you all. Lastly, I welcome all of my dear students for their presence amongst us and joining us for this event. Welcome you all. I hope everybody will have a fruitful learning. Thank you.
Thank you, ma'am. I also welcome the students and the participants from various colleges and all for the webinar. Welcome you all once again. Thank you so much, ma'am. I kindly request all the delegates to on their camera as we would like to take a snap of the webinar. I request all the delegates to on their cameras. When darkness comes, let us not condemn the dark, but light a lamp to illuminate. I request the dignitaries to come forward to light the traditional lamp and brighten this occasion. I request Mrs. Navita and Mrs. Preeti Avasti to assist the dignitaries in lighting the lamp. Thank you all. A lamp doesn't speak, it introduces itself through the world. Achievers never expose themselves, but their achievements exposes them. First and foremost, I request Professor Dr. Y.S.R. Murthy Sir, Honorable Vice Chancellor, RV University, to deliver the inaugural address. Over to you, sir.
Thank you. Mr. Raghavendra Kamblu, Advanced Clinical Practitioner, Newham University, London, and President Vishwa Kannada Nursing Officers Welfare Association, Principal RVCN, Dr. Gajendra Singh, faculty members, students of RVCN, and ladies and gentlemen, a warm good morning to everyone. I feel honored as well as humbled by your gracious invitation. I am not an expert on advanced palliative nursing care, but I wish to make a few observations on the problems faced by the elderly persons. I wish to speak from a legal and human rights perspective. If you see the Universal Declaration of Human Rights, it asserts the right to health. The International Covenant on Economic, Social and Cultural Rights, to which India is a state party, asserts the right of everyone to highest attainable standard of physical as well as mental health. Later on, the normative content of this right to health was further clarified for the benefit of various countries. It includes availability, accessibility, acceptability, and quality. Referring to the right to health of older persons, the Committee on Economic, Social, Cultural Rights reaffirmed the importance of an integrated approach combining elements of preventive, curative, and rehabilitative health treatments. Such measures, the committee said, should be based on periodical checkups for both sexes, physical as well as psychological rehabilitative measures aimed at maintaining the functionality and autonomy of older persons, and attention and care for chronically and terminally ill persons, sparing them avoidable pain and enabling them to die with dignity. Our own Indian Constitution asserts right to life and personal liberty under Article 21. The Supreme Court of India has widely interpreted this right to include under its ambit right to health as well. Life that Supreme Court held is not mere animal existence, it is a life with dignity. Provision of palliative care is not an act of charity. It is in fact a human right, obligation on the state to provide requisite services. Palliative care is not a synonym for hospice or end of life. It is about making life with a disease more comfortable, which can be combined with curative care. It does not mean you have abandoned hope of a cure. People with chronic diseases often live sometimes say 10 to 15 years, even with serious illnesses like chronic obstructive pulmonary disease, heart failure, dementia, or end-stage renal disease. No matter how long people live, they deserve the same attention to quality of life, treatment of symptoms, management of depression, support for their families, and support for issues like financing and housing. And such support should be based on need and not on prognosis. Both palliative care provided to patients who are near death as well as bereavement to families after death occurs are both important. Nurses have a vital role in providing such need-based patient care with utmost compassion. I compliment the RV College of Nursing for choosing a very apt topic for this webinar. I am sure it will sensitize the young nurses so that they can join the legacy of compassionate nurses and help the patients in chronic suffering have a relatively less impact on their survival for the remaining days. I want to compliment the organizers for putting together a galaxy of experts for various scientific sessions. I wish this webinar and RV College of Nursing every success. Thank you.
Harry.
Thank you, sir, for devoting your precious time and endowing the young peoples with your words of wisdom and experience. Thank you so much. Every thought you produce, anything you say, any action you do, it bears a signature. Now I invite Sri Raghavendra Kamblu, sir, Advanced Clinical Practitioner, Accidents and Emergency Department, Newham University Hospital, London, and President of Vishwa Kannada Nursing Officers Welfare Association to deliver the keynote address. Over to you, sir.
Sustainability initiative. And it is more about they have to mitigate the risk, and in that process they will also get the profit.
Good morning, everybody.
Few of the
I am Raghavendra Kamblu, currently working as Advanced Clinical Practitioner in London.
Financial time briefing in sustainable business.
So, I am the president of Vishwa Kannada Nurses Welfare Organization.
Sustainability initiative.
We created the Vishwa Kannada Nurses Welfare Organization
this is for the, because
to improve
for the people and
nursing practice
it is altruistic
back
benefit
home,
and
means
that's why
supporting the nursing practice to improve the
initiative.
nursing
This gives
practice
us a
as
license to the
similar like
to
international
grow,
level
because
to
if you
operate.
are known as
Because of
good
that,
and
we
sustainable
have
company,
been conducted
the
so many
growth in the market space
webinar, and we conducted so many
there is a
social
direct financial benefit in
awareness,
terms of the
means
reduced
coronavirus
energy, material
awareness
cost, and
programs.
also
Many
the
programs we have been
with
conducted
policy
since last
development.
1 year.
This gives us the ability to continue.
Part of this,
so if you remember, we introduced the concept of
this
limit,
webinar we are planning.
So
We
if
decided to
there is a limit
do
resources, unless this is being
the care of elderly and
responded
palliative
well,
care,
that
means
will
it's
stop
one of the
ability to continue
upcoming
in the
role.
production.
Because
Then
the
regulatory
reason is,
stakeholder
the main
acceptance
is
makes the company
our
to
Indian society is
undertake
changing
sustainability
to
initiative. And
modern
as we discussed in the last
family
class
or
also,
modern way
this
of
gives
living.
a protection
Because of
against risk,
that
and
reason,
through this they
the
can also
aged populations
or they
are
can do a competitive
they are going to
advantage
be
by
need to be
addressing
looked
this
after
sustainability
by someone,
agenda.
not by family. The
Now,
reason
what is
is
sustainable
the
product?
family, children and
The
others
first
are going
definition
away
is
from the
Wikipedia.
family. That is the
Sustainable
main
products
reason.
are
And
those
secondly,
products that provide environmental,
according to the
social,
World Health
economic
Organization,
benefit while protecting
by
the public health
2050,
environment over the whole life cycle,
so
from the
80%
extraction
of
raw material